And now we've got Jennifer and Aaron. And you know what I just realized? We had a call-in number and I never opened up the line. Do you think Aaron was trying to call in? Okay.
I'm not here either.
But you're channeling Aaron. And I'll hand out surveys if you want them. But you have your presentation, so let me get that up for you. Sorry. All right, slideshow.
Good evening. I'm Matt Kronshinsky. I work in patient access in the revenue cycle. I happen to recognize one of my own colleagues back here. One of the things that Mayo Clinic is working on in partnership with a company called Optum 360 is a patient-facing estimator tool to give patients an idea of what their out-of-pocket costs are going to be for the care that they're about to receive. This is something that we probably posted on the mayoclinic.org website for patients to have access. Let's click the next slide. And the real goal here is a self-service for patients where they can enter in either procedures that they're scheduled for or they want to schedule, and they can enter their benefit information and get some sort of information back what their out-of-pocket costs are going to be. So for example, we could look at things like, cost of a childbirth by C-section, by regular vaginal birth or something like that, or for twins. All this information would be there for you to access and get some sort of a number back to you to figure out what is my out-of-pocket cost going to be. What is my insurance going to cover when I enter in my deductibles, my co-pays, my max out-of-pocket, or whatever it might be for your particular plan, and give you some sort of an idea of what your out-of-pocket as a patient is going to be. We've got Jen Schaefer from Optum 360 here. She's really in charge of the whole user experience side of things with Optum, and she's going to talk to you a little bit about what that might look like.
Thanks, Matt. So as Matt mentioned, I'm with Optum 360 and I'm a user experience manager. So I just wanted to talk a teeny bit about what user experience is. And it's encompassing all of the aspects of a user's interaction with a product, with a service, or even with a company. And really what we want to do from the user experience team standpoint is make sure that we are designing products that meet your exact needs as an end user, that are simple to use and somewhat elegant, but we want simplicity to be a key. And we want to be able to build products that are efficient to use, that are easy to learn, and that are somewhat pleasing. We don't want you to feel like you're walking away from an online experience where you're frustrated or you can't figure out what's next. So as a result of that, one of the reasons why I'm here is we want to get more user input into this patient cost estimator tool that we're designing. So we actually want to get your feedback and your input before we even start building it, rather than a bunch of us developers in a room just trying to figure out what it is we think patients will need from an estimator tool. So we really want to start reaching out to people that would potentially be using this and get your feedback. So one of the first activities we have is a really simple user survey. So Fran is handing it out. There are 10 questions. It'll take you 5 minutes. Your responses are completely anonymous. We're not asking for names or any demographic information. We're also going to be putting this online. So when Fran mentioned the online community, you can log in and click the link, and you can do this online. So if you don't have time tonight, or you'd rather try it online, you're more than welcome to do so. If you do happen to fill it out tonight, just leave it at the table on your way out. So I really, really greatly appreciate any thoughts you might have. There's a little extra room on the form if you've got some ideas for us. And then we really hope to come back in a future session and actually have you participate in prototype testing. So we actually have a way where we can put together a sample prototype or a sample version of what this tool will look like and provide you with a link so at your own time you can walk through the tool and actually be able to give us feedback there. So in that instance, we would give you a link to a website, and again, at your own time, you can fill, it would be task-based, so we would kind of guide you through the process. But that is also a really great way for us to get user feedback about something that we haven't fully built out yet. So that's coming in the future, I hope. We're not ready for prototype testing tonight. Really all we're asking for is 5 minutes of your time with the survey. But I do hope to be able to come back at a future meeting and share the prototype tests. Question?
How many people here have ever asked for a cost estimate?
That's a good question. Got a handful of people. Yes, sir.
This is sort of almost in line with what I was asking before with the last speaker. In this procedure, if the insurance companies are likely to question a particular procedure, and there are certain procedures, for example, a certain kind of Holter monitor, or something that's sometimes questioned, are you able to asterisk it so if somebody looks at the cost estimate, they'll be able to see that certain things may not be covered, that you should look into it further?
Good question. It's something that's very difficult. You're getting into the whole coverable benefit issues and things with insurances, and as you know, there's lots of little things that are insurance guidelines that will make it very, very interesting. You brought up radiology as another very good one. You know, some insurance companies or plans might cover certain things based on your diagnosis or whatever it is. Very good question. It's really something that I think we're going to direct back to the patient to try to get an understanding of. They understand their plan probably the best. When they enter the information in, they're probably have to try to figure out, well, is this going to be a coverable benefit or not? Do I need pre-cert now? Am I going to do that? Does Mayo help me do that? Whatever it might be. And they can figure that into the estimate.
No, I'm just saying, though, it would be helpful if there's a way that you could sort of help the patient to help themselves a little bit by steering them on certain things, like for example, mentioning that some insurance companies require pre-certification.
Right.
Or for example, or something like I said, like the Holter monitor, like say that Medicare questions that in certain situations. I mean, it'd be helpful to know that, because Medicare affects lots of people. So if there's certain procedures that are either not covered or challenged frequently, rather than just say, well, this is covered for $400, I think it'd be better to say this may be covered for $400, but this procedure is sometimes questioned. So because I think that's, otherwise people may be given a false impression about how much we get back.
Right, and that is a big concern of ours, because we can't fully replace an actual person that has all of the data and all the knowledge and knows all of the little intricacies of a specific person's situation.
So
but we do want to try to get close.
So phone line, for example, if people have questions with your website to sort of get further feedback would be useful.
Mhm. And back to the first question that was asked, you know, who gets cost estimates? I think some of the examples that we found are those folks that are looking to have a cosmetic procedure. So maybe they want a facelift. And so they might want to see how much a facelift is going to cost at Mayo versus a clinic in their hometown. And there may also be patients, well, there may also be users that aren't actually patients at Mayo, but they would like to see a doctor at Mayo just due to the reputation. So they may be curious, they may find out what the cost of a hip replacement would be at their primary care providers network, but they may want to see what Mayo's cost would be for their out-of-pocket. So we do feel that there is the possibility of a level of a shopper, somebody that might want to do some cost comparisons. Yes?
I just got a question. Sometimes when I ask for an estimate, call the clinic estimating area, then you say, well, depending on, the bigger, sometimes it actually comes down to a medical code. It could be this code or it could be that code. So then I'd have to call back the department that I was talking to find out, okay, if I had X procedure done, what code would it be? And then I call them back and they tell me. But if on a website, if you said, I don't know exactly offhand which thing I was thinking of, but if you're into the website, I mean, how would the average person be able to say, oh, this is what I want to have done? And, how would the estimating site be able to tell them without a code? And I'm just concerned about without that exactness, then, but for me, in my case, all I wanted to know was what kind of base cost am I looking at? Does it usually cost like, what it cost like 500, does it cost 100, or are we talking $4,000? You know, because then from there I can figure out insurance and do whatever I have to do.
Right.
But I just wanted to get kind of a base idea, are we talking 10,000, 4,000, 1,000, you know, what am I looking at to even, consider? You know, and that's what I'm kind of concerned about a website, you know, 'cause especially if you have to dig up all this information, you know, and then you don't want to get an estimate and find out, well, this was for procedure B on the website, you had procedure C, which unfortunately is 10 times more, so, you know, I mean, you know, because then it's like, well, then you might as well just give people the estimating area of the clinic and say, you know, supply the medical, you know, the code number of the thing, then they can tell you the cost, and then you can go from there to insurance. I guess I'd be more comfortable with that, at least then I'd figure out getting more accurate information. If I'm telling you I'm having item C1112-1 done, and you say, okay, C1112-1 costs X,
Right.
okay, then, yeah.
Yeah, that's a big concern. Do you want to say anything, Matt?
No, that's okay, I understand.
Okay. Well, no, but that's one reason why I'm here, because one of the things that we want to do is we want to be able to test. We want to be able to test ideas out. So we want to be able to put, before we even build the product, we want to be able to put together a prototype and actually have actual users try to tell us what procedure that they are looking for. Do you need to know the CPT code? Do you not need to know the CPT code? So that's the sort of, these are the interactions that we're looking for from all of you as we move forward in development, because it is a big concern. You know, you don't want to have a cost estimate that is $10,000 more than, or you don't want your bill to be $10,000 more than the estimate. So there's a lot of different ways we can try to remedy that, but we'll be looking for feedback.
So then also, are you going to be talking to the people in the Mayo estimating area about the calls that they get?
Yes, we have, yeah.
Okay, that's what
Yeah.
I'm gonna say, because then they might know that, well, we do get calls about X, and as far as this, whatever X is concerned, there are 3 or 4 different variations of X. You know, so then that way a person would know they couldn't just plug in nose job or whatever.
Right,
You know,
yep.
and then, yeah.
Yep, we've definitely been talking to them. You had a question, Ann?
Twice, my husband was put into the hospital from the emergency room by the Mayo staff. And after he's been there for a couple of days, we get a notice that he's been put in on observation.
Yep.
And there's all kinds of things Medicare doesn't plan to pay.
Yep.
And we had no control over him being put in the hospital. And we had no clue that we would be responsible for all of these charges.
Medicare doesn't cover observation time in the
Well,
hospital.
why are they putting him in on observation when they're putting him in the hospital?
Well, there's medical guidelines that they follow for when you're in observation and when you're
Well, then they
inpatient.
need to tell us when we're still in the emergency room. And if he's too sick for me to take him home, then he's a hospital patient.
I understand that one.
I think there are some legalities that the patient has to be told what the legalities are, Medicare, when they are admitted to observation. And the social worker or somebody should have come to explain.
Yep, totally
And then somebody
understand
should
that.
have come and explained when the observation deadline's over, like 24 hours or 48, whatever it is. I think if they don't do that, the mayor can put the bill.
But I think that's even this website, being able to have examples of things that are frustrating for people.
Sure.
To have those there, to say, if this happens and this is, how can you cost estimate something like this happening for people in certain situations?
Yeah, that's great feedback.
Do you know what I mean?
Yeah.
So it's something that they might necessarily not know about how to do, but having it as a reference there to say, FAQs, and someone looks at it and goes, oh my goodness, I never knew this, so that when they do end up in the ER, they can challenge it or address it appropriately.
Mhm. Yeah.
Because we don't have control over it, but what control or what knowledge can they have to help them prepare for that?
Right.
Is that something that's a part of this that could help?
I think we do want to be able to provide as much information about a procedure as possible.
Mhm.
I don't know to what level detail, we haven't gotten that far.
Right.
But I do think that, you know, risks for the procedure should be available to the user so that they know what potentially could happen, and that this cost estimate is for as much as we know now for that patient, but then there might be variables that are unknown. Maybe something happens during the procedure that could potentially change the outcome of the claim.
It's tough on house things.
With all the changes like in affordable healthcare and in the last few years, are there more people that call in for this kind of thing?
I think what's happening is more of the plans are shifting more out-of-pocket costs to patients. So you're starting to see patients wanting to know what those out-of-pocket costs are going to be. There's more plans that, I guess I'll say this, that the less Cadillac plans is probably a good way of saying it, and more responsibilities being shifted to the patient for certain things. Back to your question of things on pre-certification, more things are needing pre-certification and prior approval now than they did 10, 15 years ago. So they're shifting more responsibility to patients to be active in their care, understand what their out-of-pocket costs are going to be, understanding what their plan covers. You know, it's getting tougher and tougher to understand what your out-of-pocket costs are going to be. We're trying to give a mechanism to give you some sort of an idea right up front.
And we do in the survey ask a few questions about how much do you understand about your insurance, and I will claim to be, I don't understand my insurance. I don't know what my deductible is. I don't know any of that information. And we need to figure out a way to guide the user in this tool to give as much of the information as I can so that we can give accurate numbers back. Yes?
Another thing I want to mention in terms of Medicare is when you call Medicare, I don't know if you're aware of this, but when you call Medicare, they'll always say, we don't know what the cost would be, you have to ask your doctor. So that's like every time you call. And then when you ask the doctor will say, we don't have any clue, you have to ask the business office. And then when you call the business office, they'll say, we don't know either, you got to call Medicare. So it winds up being this like thing that nobody actually answers.
Medicare will never tell you if they're going to cover anything up front.
Exactly, and so the problem then is, and the patients are not allowed to speak to the contractors who actually make the judgment. They're prohibited from doing that. And so they'll tell you the only one who can do that is the doctor. So basically, even though we're responsible for the bills, the patients, nobody is giving us information to make the decision on. And that's a big issue.
Yes.
The tool identify like if the person would have coverage at Mayo before they give an estimate and then find out that the plan excludes me.
Good question. What's that?
Oh, you can hear it.
The question would be is like, I think where you're going with this, do you have coverage or access to get in the door at Mayo Clinic? Are you in network, out of network, that sort of thing? I think we've gone round and round about this. Any feedback you have on that, we would greatly like to see that, I guess, if you could write that down. But I think it's very difficult to automate that process. That's something that we would have to have the patient say, I know based on my plan that I've got with Blue Cross or Aetna or Humana, that I've got access to Mayo, I'm in network or out of network. We could put a disclaimer on there that you guys are going to have to know that, or have some information to put that in. But it's pretty hard to automate that. Especially for like a shopper or something
Well,
like
that's
that.
what I thought, if you've got a shopper, and
Yeah.
they're just looking at the dollar amount, not paying attention to, and then you can go to me.
I think ideally we have thought it would be great if, and I don't want to make any promises, but if you were to be going to this tool from the patient portal and your information is in the patient portal, you've logged in, what information can we pull into the tool so that you don't have to re-enter it? That would be ideal. I think that would make the experience much easier. But I think we're still working through the logistics of all of the different systems potentially talking to each other. But I think that would alleviate a lot of the benefit questions.
Are there other hospitals that do this, like Abbott Northwestern, Minneapolis, or any Minneapolis groups, Alina, or?
There are patient cost estimators out there. I think a lot of the questions that you guys have about like observation or pre-certification or in-network, out-of-network status, I would say that none of them that we saw really cover a lot of those tough questions. We're gonna try to tackle them and try to get you something like that can do that, but those are really, I mean, they're not easy solvable things. We're gonna try to figure out what we can do. Lots of hands here. Let's go back here, yep.
Quick clarification. For status, there's inpatient, observation, outpatient. Are there any other categories or are those three covered?
I think that pretty much covers it.
Okay.
Yeah, and I think for the tool that we're working on, our focus is on procedures, and largely that would be inpatient and outpatient procedures. Yes?
Okay, two questions. One is about the base cost and the other one is about the carrier. So would it be possible in this, I don't know about an application program, to give a person the option of, you know, I just want to know the bottom line, how much does the procedure cost? Or B, yes, I want to enter my insurance information, you know, so they could do that. And the second question is, like, okay, the survey, you know, a person could enter like your medical care provider and your deductible, stuff like that. I mean, say, you know, I don't know the names of all the places that provide insurance, but say they were from, you know, Ipsyville in New Jersey, and they had some strange insurance company that the average person hasn't heard of. What good would it do to know the medical carrier if, you know, it's not like the program would necessarily have access to every single medical carrier in the world. It just becomes another bit of information of, okay, why am I telling my medical carrier if you can't access the information, it makes no difference on the other information, you know, so that becomes a kind of a, you know, okay, I'm giving them this bit of my privacy, but it doesn't really help me anyway. You know, and I can see the other information, like, you know, if the person wanted to get, you know, all the basic facts of how much of a deductible do I have, okay, I have this much, but then it's like, well, how long do you use it, then to figure that out. But anyway, I mean, you know, but, you know, so I suppose the person, you know, didn't have any calculating abilities, then if they put in that much information and, you know, at least call their carrier to find out what that information was, you know, before they went to the website, you know. But I guess that's kind of a question of why give up certain pieces of information. You know, it doesn't do any good. It's not like you're accessing everybody in the world to know.
Right.
You know, and then you still have to have a basic disclaimer of, you know, some things may not be covered by your policy. You need to check with your insurance thing. Otherwise they think, oh, okay, Mayo told me I'm going to pay $20, the price is $200. Well, you know, our policy doesn't cover that. Well, you know, you just kind of, you want to be helpful again, and
Right.
digging yourself into a hole sometimes.
Yeah, and I think our goal is to start at a high level, again, with the shopper. And so with the first version of the tool, you're gonna get a cost that is about as close to out-of-pocket as you can get. But then we want to be able to let the user provide more information as they're comfortable doing, so that we can get closer to a more detailed cost. I know we're
We're over time, and so, thank you
Yeah,
both so much for
Thank you
coming.
all, I appreciate it.
And, like I said,